And welcome to the Social Justice Forums. I am your host, Daren Jaime. We thank you for joining us. Now, if you're asking the question, what is this show all about? Well, we bring you a forum discussing and providing deeper understanding of the issues and inequities that so many people face. Things such as systemic inequalities to pressing social problems. Our guests provide multiple perspectives as well as insights, helping us better understand and address the challenges. So we invite you to stay connected with us as the Social Justice Forums begins right now. And welcome back. Planned Parenthood of Greater New York is a leading advocate and provider of sexual and reproductive health care in New York State. With 23 centers covering 65% of the state, they proudly serve over 560,000 Latinx patients annually. And Latinx individuals face significant barriers to accessing sexual as well as reproductive health care due to the factors like race, immigration status, income, and nearly a threefold higher likelihood of being uninsured compared to non-Hispanic whites. Joining me now and discussing more is the Director of Community Engagement at Planned Parenthood of Greater New York, Angelica Medina, and we thank you so much for being with us.
You. My pleasure.
Thank you. And so, as you talk about the work that's going on at Planned Parenthood of Greater New York, thank you for taking the time of being with us. And, as we talk about Hispanic and immigrant communities, when it comes to these rights, reproductive rights, things like that, it's a struggle somewhat. Explain.
Absolutely. Immigrant communities are impacted in such negative ways, especially as with the recent events occurring around reproductive health, but in general, right? So migratory policies, reproductive health policies, it all ties up and it results in these communities becoming even more marginalized and vulnerable. It places barriers on reaching and the healthcare that people need. And I think we can agree that healthcare is a fundamental human right. So that is where our communities are, especially as well talking about the recent migratory crisis into some of the states.
Yeah. And so for yourself, what are you seeing coming across your door by way of, clients? Are you seeing any common threads and trends?
Absolutely. So my team, which is the community engagement team, um, part of our work revolves around our Promotores de Salud program. So the Promotores de Salud are community health workers. It's that kind of model. They are people from the community who go into different community settings to reach those who are vulnerable, right? So our community health workers, our promotores de salud, are exposed and observing and hearing from devastating cases, very tragic, as people come into cities like sanctuary cities like New York City, for example. We have heard of sexual assault cases, murder, people just coming seeking basic needs like shelter, food, work, and healthcare. So that's where our team has been trying to contribute to by partnering with other organizations as well to be at in the trenches, trying to see where the needs are and how we can help. So that's sort of where we are. And obviously, the important piece here is that our team is also connecting community members and the new migrants, asylum seekers, refugees to our health centers to get them the sexual and reproductive health care that they desperately need.
I think that sometimes, when we talk about sexual reproductive health, migrants, asylum seekers, they're not at the forefront of the list. And I know that's the great job that you guys do In terms of making people aware of what's going on and what some of those, what some of those specific needs are, when you get those persons who come across your door, how hard is it, if you will, to get them? Because we talk a lot on our show about access to resources, right? And how many times people are really plagued by access to resources. But not only do you provide access to resources, you also help bridge that gap.
Yes, so on our end, we are tackling this issue from different perspectives and different approaches, right? So we are providing the clinical services. At Planned Parenthood, we do not turn anyone away just because of the lack of ability to pay or lack of health insurance. We are trying to accommodate our schedules. Our clinical team is ready to serve these communities as well. And our community-facing teams, like like the promotores, like our RAIS program. RAIS is our part of our organizing team. They're trying to advocate for these communities as well to receive the services they need. And our team also advocates for the passing of federal bills, like coverage for all, for example. Well, that's the New York State bill, and it would expand the essential health plan to include people that do not have access to healthcare because of their immigration status. But also at the federal level, we need to be able to facilitate the new migrants to obtain their working permits, for example, that would enable them to make an income and living. That means that they will be able to receive transportation and pay for healthcare services, even if they're, low cost health services as well. So that's why it's all tied together. That's why all of that is important. So we approach it from the clinical standpoint, from the community engagement standpoint, and also advocating for policies that can improve the lives of all the new immigrants as well as the old-time immigrants as well,
Yeah.
and all other marginalized populations.
When we talk about marginalized populations, sexual health is a big issue, and I want to talk about sexual health because it's viewed as a social issue, a racial justice issue, an immigrant issue. How do you make the correlation between sexual health, immigrant, and racial?
They are all tied together, even if it may not seem evident on the surface. Racial justice is sexual and reproductive health justice, right? Reproductive justice is racial justice as well, for various reasons. Because when we are talking about reproductive justice, for example, we talk about having bodily autonomy. And what does that mean? It means that every human being has the right to make decisions about their own bodies and about whether to bring children or not, how to raise their children, how and under what circumstances. And we all deserve to raise our children in a safe, sustainable environment. So when we see the intersection of race, for example, in our communities of color that are, and the bodily autonomy and that right is taken away, which has been done, particularly in recent months or the recent couple of years. All results in our communities of color becoming even more marginalized and not having that ability to choose, right?
Right.
So that is part of the issue. Also, the other way in which it intersects, for example, and specifically to the immigrant community, is that a lot of our immigrants in Latinx communities, for instance, live in the states that have implemented severe bans on abortion, for example. So when people seek a healthcare service such as abortion and they don't have the access to it, their lives are also altered. They are faced with very difficult decisions and they might end up, it affects not only themselves, but their whole family, their financial stability, their whole family unit also gets affected by these policies and these barriers that we're facing. So it's all interconnected.
Yeah. And when we talk about being interconnected, obviously, there's a lot of common threads that weave all of this together. We talk about sexual health. We talk about reproductive health. We talk about access to affordable health care. All of those things are common threads that we always talk about here on the show and we see prevalent in our own communities. But when we talk about stigmas, I want to have an opportunity to share a little bit about that because there are some stigmas that sometimes do create these barriers, right? And I want to give an opportunity for you to address some of those stigmas and let's clear it up because I think that would be better in terms of landing safely because when you have stigmas out there, it's sometimes it becomes a hard sell for people.
Absolutely, and that's a great point. Stigmas and the reality of systemic racism plays a role in sexual and reproductive health as well. In fact, throughout history. So what it translates to in terms of their daily lives for an immigrant, for example, is that they're facing language barrier. They're also stigmatized by the healthcare system, and there are we know that the quality of care and the way these communities might be treated are different from what other people with more access can get access to, right?
Right.
So for example, the language, immigration status, for instance. We have heard of cases where in some healthcare institutions or in some healthcare system or settings, people who don't have English proficiency, their symptoms might be dismissed or they are not necessarily explained what their diagnosis might be. So they get a lot of misinformation. They are not able to advocate for themselves. There's a lot of insurance claims that might get denied. And, you know, again, that creates this whole other set of issues stemming up from that. So, so the sexual and reproductive care, it is crucial. These communities need access to it. It's life-saving. And so having access to cancer screenings, for example, which affects the Latinx community increasingly, for example, cervical cancer or STI testing and treatment, HIV, for instance, that also affects especially Latinx women and trans women. So all of those are conditions and needs that are affected by the stigmatization and almost dehumanization of immigrants and members of the Latinx community as well.
Yeah, and I know that everybody's been dealing with the after effects of COVID, but what has COVID done for the organization in terms of the work that you're doing, increased caseloads? Talk to me about how you guys are navigating in this. I can't say it's a post-COVID environment, but you get the drift of where we are today.
It was definitely challenging, as it was for many institutions, especially nonprofit organizations that already operate under capacity and with limited resources, right? But I think our response as an organization was incredible. And on the clinical side, there was a transition, and we never stopped offering our services. There was commitment from our clinical staff, everyone to continue providing the services and keep our doors open to those who need it. There was also an expansion into telehealth, for example, and a lot of our services are still to this day able to be provided via telehealth, which it has been, um, a positive outcome of that whole transition into more of the virtual world that we all now live in. And in terms of our community engagement team and also our education team, for example, we also transitioned into providing education and outreach programs virtually. So now we do a mix of both. Our work is hybrid in terms of community, forming relationships with community and collaborations and partnerships, which is very crucial to our work. So we're able to even reach more communities and across the city and also the state, because we have that approach that was initiated through the COVID crisis. So we continue to provide that work as well. So it was one of the again, the benefits and positive outcomes, so that we can carry that into the work. And it has facilitated a lot of collaborations that we never imagined.
Yeah, yeah. Well, Angelica, I want you to take a few moments for those of us who may not be so familiar. People may know Planned Parenthood only in one dimension only, but share with us a little bit about the work that Planned Parenthood does throughout the course of the year.
So we are a big organization. We provide a lot of different services. As you mentioned in the introduction, we have 23 health centers across the New York State region, providing those clinical services, which range from cancer screenings like cervical cancer, breast cancer screenings, for example. We also provide STI testing and treatment, pregnancy tests, options counseling, abortion services, the whole gamut of sexual and reproductive care. We don't stop with the clinical services, so we complement that with helping our communities and hearing our communities about their needs, and how and forming those meaningful partnerships with community agencies and other stakeholders, so that we can tackle some of the other issues and all the other intersections, such as racial justice and economic justice. So because it's all connected, right? So in terms of other teams at Planned Parenthood, there is education. For example, we have a big team that goes into schools to provide comprehensive sex education, which is incredibly important, so that people can make informed decisions about their own bodies and their own healthcare. Our team, which is community engagement, we reach adults. So we have teams for youth, we have teams for adults, and also our advocacy arm, which does great work at the legislative level as well. So we expand the whole gamut of services in the fight for sexual and reproductive rights and equity for all.
Yeah. A lot of work goes on, and we want to thank you, Angelica, for being with us. Angelica Medina, who is also the Director of Community Engagement for Planned Parenthood of Greater New York. We thank you for taking the time to share with us a lot of stuff to pay attention to, and of course, we'll keep our viewers up to speed. So thank you for taking the time for being with us.
Thank you so much for having me. It's a pleasure.
All righty. Well, we're taking a quick break, and guess what? We'll be back with more right after this. And we are back. Outright International is an organization tackling human rights violations and abuses directed towards lesbian, gay, bisexual, transgender, and intersex individuals. Over time, the organization has transitioned its focus to actively promote the human rights of LGBTIQ individuals on a global scale. It's devoted to collaborating with partners worldwide to enhance the capabilities of the LGBTIQ human rights movement. And we've got with us now, sharing more, the Senior Development Manager of Outright International, Chandler Bazemore. And Chandler, thank you for being with us. I guess the question is, when we talk a little bit about these rights, and we talk about the fact that the rights are out there and they should be, it should just be the way that it should be, but the reality is it's not. And you got some work to do. So glad to have you with us.
Thank you so much, Daren. I appreciate this opportunity with BronxNet to be able to share the work of Outright. So thank you so much for this platform.
No, glad to have you. And so when we talk about Outright International, obviously you guys have been at the forefront, as we said, since 1990, really bringing forth advocacy and rights. Talk to me about where you are today.
Sure, excellent. And you set it up just perfectly. So we were founded in 1990, and since that onset, and which has shaped our work, is that we have been focused on strengthening the capacity of the LGBTIQ movement, and we do that through documenting and amplifying human rights violations, and also advocating for inclusion and equality. So that has been our driving force, and we framed our work under four pillars. And those four pillars are to amplify, meaning that we want to spread the word, that we hope people would join us in spreading the word about the work that Outright is doing and that our activists are doing. You can sign up for our newsletter at outrightinternational.org, where you will receive monthly just some of the things and the issues that are prevalent and going on in the LGBTIQ movement globally. Also supporting Outright. The movement takes funding, so you're given opportunities to fund not only Outright, but also our work in how we support our grantees and our activists. And then also advocating for LGBTIQ human rights. And we do that through our relationship, our unique relationship with the United Nations. Outright is privileged enough to be the only LGBT organization that has direct access to the delegates and the ambassadors at the UN. And through our work with the core group, which is a group of countries and delegations that are committed to ensuring that the LGBTIQ movement and also the issues that we face are always reflected in anything that the UN does. We're sort of, the core group is sort of a watchdog on the other 193 countries represented at the UN to make sure that our movement, our issues, and our challenges are placed at the forefront and given the time and the attention that it needs. And then finally, our last pillar is to celebrate the accomplishments that Outright receives and that our activists and our grantees receive. These accomplishments are few and far in between and hard fought. So we want to take the time to celebrate those moments and celebrate the movement and be able to encourage and foster change and growth. So we want to take the time to smell the roses and share our flowers, so to speak.
Chandler, help me understand a little bit more the more prevalent issues right now, because as we all have watched and seen, we've got incidents of hate that are still permeating our community. But from a person with boots on the ground, what do you find to be the most prevalent issues that you are dealing with right now?
Well, the one unique thing about Outright is that we don't take a colonizer approach where in the sense that we go in and dictate what our grantees, our activist partners, and organizations that we partner with globally, don't go in and dictate what they should be working on. We follow their leads. So the issues and the challenges are as varied as the different countries and regions that we represent. But one of the core themes and threads throughout is to address the issue of visibility. Because with visibility, there is the acknowledgement not only of our presence, but the acknowledgement that our issues and our challenges should be addressed and can be addressed. When organizations are visible, they have a right and are entitled to a seat at the table. One of the pillars that Outright has been since its founding is our research. So we compile data and release reports on the trends and the things that are going on in the LGBT community. One of our most recent reports is on the importance and the significance of LGBTIQ organizations registering within the governments and the countries that they are involved in. And the reason that this is important and registration is important is because one, not only is it visibility, but it's also the acknowledgement of existence. And then in times of crisis, when organizations or countries are distributing funds and resources to rebuild and address issues, the organizations that they go to first are those organizations that are registered with the government. So it is about visibility and also being able to have a seat at the table and having access to the rights, privileges, and protections and resources that all organizations are facing. So I think the overwhelming thread that connects all of the issues that our organization and our grantees are dealing with is the issue of visibility, is the acknowledgement of our presence and the importance of the issues and challenging and giving a platform to address them.
You know, when you talk about using that word, having a seat at the table, the first thing people always think about is that corporate seat at the table. But the reality is that having a seat at the table is not just at one specific location, it's really all across. When I think about the work that you're doing right now, you're not just local, you're not just national, you're international, you're global. Giving global advocacy. Take us behind the scenes, if you will. Give me a little bit about the global advocacy piece and what you guys are doing there.
Sure. Our global advocacy is really grounded in working with distinct groups to advance their agendas and advance and promote their work. So, our global transgender program is about raising support for trans activism. And really, as I mentioned before, the key with that is visibility. In many countries, they are not allowed to organize. They are not allowed to have a presence. That presence is often suppressed and ignored. So, with our Global Trans program, it's really about supporting trans activism and strengthening the movement, increasing that invisibility to raise awareness of the issues and highlight the challenges that they're facing. So, in that program, we prioritize trans activism and we focus on collecting data and research. You know, as you hear, I always come back to the data and the research because that is really one of our core principles. But it's so important to be able to document these stories, to document the challenges, because that leads to a more comprehensive understanding and also inclusion and support. So a lot of the work that we're doing is about raising that visibility to support those institutions, organizations, and communities so that their issues are elevated to the forefront so that they have the resources and the ability to address their challenges to affect change. Another group that we are working with is our LBQ Connect program, and that is the Lesbian, Bisexual, Queer Connect program. And it's a global feminist program for lesbian, bisexual, queer, cisgender, transgender, and intersex persons, all those that identify with a female perspective. And it's about empowering their activism. It's a program, it's a mentor program where we recruited and identified 50 activists and we paired them with a mentor. And this is a global program, totally virtual. And in that partnership with their mentors, they have a resource to go to really discuss issues that they have a sounding board to be able to provide advice. And there's also convenings of the entire group so that there is that broader discussion so that they can share information, share success stories, also share what their challenges are to really tap into this broad scope. The reason that this program is so important is because it also provides funding through grants. One interesting and actually sobering statistic is that all of the funds that are raised and provided through governments, through private foundations, all of that money that is raised, that pool of money broadly raised, only 1% of that money is earmarked, dedicated, and funneled to LGBTIQ organizations. Only 1%. Of that 1%, 5% of that goes to LBQ focused organizations. So this is a community that is underserviced, under resourced, and really what we want to do is amplify and advocate for them and to build and support that. So we are funding, finding, and supporting the future leaders of the LBQ community.
Talk to me about the United Nations because you have a very special relationship with the United Nations from a consultative standpoint. And I know we'll break it down for us really quickly because we only have a few minutes left, but I want to be able to talk about that relationship and what that actually does by way of advocacy and also information sharing.
Yes, that the UN relationship is a very complex relationship in the sense that it is an environment where there is a lot of discussion. A lot of the issues that are addressed is on human rights issues, broadly speaking, and our relationship with the core group, and we are the secretariat of the core group, is to work with this contingency of over 30 countries that they have made and staked out and taken the position of support for LGBTIQ issues, for identifying and amplifying human rights violations, for any of the legislation or any of the documentation that comes out of the UN that's addressing human rights is inclusive with gender non-conforming language to make sure that that is included in that. So it's a lot of consensus and relationship building that we do at the UN and support our country allies in providing the resources, the research for them to be able to go into those circles and advocate to other countries about why this is important and why this is an issue that they should address and oftentimes hopefully change their stance and their opinions on things, because as we all know and as we know from Uganda, that the oppression is really happening from a government level where laws are being enacted, rights are being taken away to diminish the presence of the LGBTI community. So at the UN level, we are hopefully able to build these relationships through the core group to be able to advocate for change.
Yeah. And as we think about where we are right now, obviously sounding, having a voice, sounding out what the issues are, that's important, right? To be able to talk about what the issues are, what are the things that are prevalent. But I want to ask the question from a global perspective. Are you finding some common themes between what the challenges are that are being endured here in the US versus globally?
I think yes, there are definitely some similarities. I would say, and this is my own personal kind of philosophy and feeling of that, is that the issues that the LGBT community are dealing with here in the United States are tragic and they are horrible and reprehensible. I would say globally, the level that the LGBTI community globally is impacted, they're about 20 years behind where our LGBT activists and the movement is here, in the sense that things are a lot more oppressive, things are more entrenched and institutionalized, whereas we have in this country the right, we do have our rights, the ones that still exist, that they haven't tried to whittle away. There is representation and there are rights and privileges that the LGBTI community has here. In many of the countries that we work with, they aren't even at that level where they are able to, they're fighting just for the existence and the acknowledgement. And for them to get to the point where they're fighting for rights as same sex marriage or partner benefits, those are advanced struggles that many of the countries that we work with, they just aren't at that level. They're at a basic survival, acceptance, visibility level. So I think there's so much more work that can be done and what needs to be done to be able to provide an environment where they're able to not only survive but to thrive.
Chandler, you have a great heart in terms of advocacy, and I know that you advocate for social justice and the rights of the LGBTIQ community. Where does the passion, where does this passion breed from?
Well, for me personally, I will admit to not admit my age, but I am of a generation where my parents were of the civil rights generation. So I've always been exposed to or had a commitment to community and understanding that we are part of a larger community and that we need to actively be involved to create the community that we want to live in. So it's really, I attribute it a lot to my parents and um, their teaching of sensitivity, empathy, and involvement in activism.
Where we are today, do you find that, we talk about fundraising and a lot of money had to be really put out, and it's been said, towards government, towards awareness, making people aware so that way these rights could actually become law. The fundraising component, it still continues.
It always continues. You have to fund the movement. There's always going to be a need for resource building, for resource generation, to be able to provide resources for underserved communities and be able to train the next and future leaders of the movement, to be able to sustain the movement and advance the movement. It's fundamental and it's essential that we support, financially support the movement and the activism. So fundraising will always be a need, and always there's room at the table for more.
Uh, Chandler Bazemore, we're out of time. Got to thank you, brother, for coming and being with us here and sharing so much on what is going on with the work of Outright and in the LGBTIQ community. Sometimes I leave out a letter. I want to make sure I got it all together.
No worries. Thank you so much for this opportunity, and we appreciate BronxNet wanting to advance and amplify our mission.
Hey, thank you, and thank you for the work that you're doing as well. All righty. Taking a quick break. We'll be back with more right after this. Welcome back. The Greater Harlem Coalition aims to balance compassion with the call for equitable community resource distribution. Their goal, to put an end to a decades-long practice of concentrating programs in Harlem while also providing support to the neighbors grappling with the systemic and generational disparities in health, economic, social opportunities, and safety. Joining me now is the Harlem community activist and co-founder of the Greater Harlem Coalition, Shawn Hill. And Shawn, good to have you sharing with us. And, I got to give my personal disclaimer here, born and raised in Harlem. And so I'm very familiar with all that goes on out there. And when we talk about the issue of Harlem and the things that are going on by way of this particular matter, very spot on. So let's get right at it. You know, when we talk about lack of fair share, we've got a lot of needs, but yet and still it seems as though with a lot of needs comes a lot of resources. Break it down for us.
Certainly. So thank you very much. I think in the literature, these programs that you're referring to are often known as LULUs. Those are locally unwanted land uses. And so, as you undoubtedly know, and your audience knows, the history of redlining in this country has meant that certain kinds of facilities, certain kinds of programs, whether they be public or private, are frequently located in communities that were formerly redlined and continue to be. And other types of programs or facilities are located in areas that were not redlined. So in our case, in Harlem, the Harlem that you know well, we find that one of the largest concentrations of overdose prevention programs, opioid treatment centers, harm exchange and harm reduction programs are all concentrated in Harlem and East Harlem, as well as, for example, the South Bronx included in that. So we find that the pattern of distribution of addiction treatment programs almost perfectly mirrors the historic 80-year-old pattern of redlining, where neighborhoods and blocks and districts that were redlined in the 1930s are the neighborhoods that today in the 21st century have a disproportionate share of addiction treatment programs.
Yeah, well, I'm gonna say from the outset, I'm gonna ask you this question knowing full well the answer, but I'm gonna have to ask it because, you know, that's my job. Somebody's gonna say, listen, having resources is a good thing. Having a lot of resources in a community is a good thing. And your answer is?
And my answer is that addiction treatment programs are a very different kind of program. And in excess, in fact, it can induce a sort of negative behavior spiral. And what we've seen in Harlem and in other neighborhoods around New York City is when there's a density of these programs in a small geographic area, that of course means that a number of people seeking treatment come to partake of the treatment or the needles or medically assisted treatment. Unfortunately, not only they come to the neighborhood, but also we find that dealers who want to prey upon those people who have used in the past and perhaps are vulnerable to re-engaging in addictive behavior. And when the dealers themselves become concentrated in a given neighborhood, that then brings a third group, which are people that are not interested in treatment or care or clean needles or whatnot, but simply want to hang out and buy and get high. And so unfortunately, our model is not currently the model. Right now, the model is to pack programs in communities of color. But our model in the Greater Harlem Coalition is that we would like to see small-scale, effective programs for addiction treatment located in all New York neighborhoods, whether they are white neighborhoods, black neighborhoods, mixed neighborhoods, high income, low income. We think all New Yorkers need access to effective treatment in their communities.
Let's look at some numbers here. I want to take a look at the numbers here. Out of 64 New York State Assembly districts, East Harlem, which is District 68, and Central Harlem, District 70, combined have 18% of New York City's total opioid treatment program capacity. That's about 5,700 patients, despite the two districts only having 3% of the population. And the other number that I want to point out is 36 out of the 64 districts have no treatment capacity at all.
At all. And I think there's a kind of schizophrenia that goes on within the addiction treatment world. On one hand, We've been increasingly told in the last decade or so that addiction is not simply a Black problem or a community of color problem, but it impacts white New Yorkers, middle-class New Yorkers, everyone. And yet, time and time again, we find that the programs to address this scourge and epidemic are concentrated in formerly red line neighborhoods.
Yeah. I want to talk a little bit more about adult-only shelters and their reaching capacities. What can you tell us about your findings when it comes to adult-only shelters?
So again, we find that adult-only shelters tend to be predominantly located in low-income communities of color. And mostly we find that that happens because communities like East Harlem and the South Bronx, for example, have low levels of social capital. Other neighborhoods like the Upper East Side, which is our neighbor, or the Upper West Side, have very large repositories of social capital. People are able to call upon, a friend who writes for a newspaper or somebody else who's willing to give, pro bono legal support, etc. And so we find that even when neighborhoods such as the Upper West Side or Upper East Side are asked to take part of their fair share, the wall or the resistance or the fight against these programs is intense. We saw that 2 years ago when people were moved because of COVID into the Lucerne Hotel in the Upper West Side, and the media furor and legal action and fundraising that went on in the consequence of just a 200-bed shelter was simply out of keeping with and disproportionate to the Upper West Side's share of single adult shelters.
Yeah, we hear a lot of conversation too, not in addition to shelters, about mental health and the need for equitable and supportive housing for mental health, those who are dealing with mental health challenges. When we look at where we are right now, what is the landscape like from your perspective?
I think, unfortunately, what we have done as a society is we have used the street as our psychiatric facilities. I'm old enough to remember in the 60s, New York State and New York City had a number of psychiatric facilities. They were closed, many of them, because of gross abuse and problems. I think we all remember the film The Cuckoo's Nest, which highlighted the problem of psychiatric facilities. And although there were incredibly systemic problems with those institutions, when they were closed, we didn't have, as a society, a solution for the patients that need care. And instead, we simply asked families who may be struggling themselves or put the patients literally out onto the streets. It's one of those things. The tragedy of America in the 21st century is we are not caring for the people who are some of the most vulnerable and need the most care. We put them on the streets.
Yeah. So, Shawn, I know that there's some legislative priorities out there, things that people should be paying attention to and possibly partnering with in terms of sharing your voice for these particular matters. So legislatively, what's out there on the table that people should be paying attention to that could deal with some of the matters that we just talked about?
Well, right now we have in New York City a fair share guidance, but it is not law. And so anything that we can do to change the fair share guidance to being a fair share law so that all New York neighborhoods need to take their fair share of facilities, programs, and the good as well as the bad. Secondly, I would say at the federal level, one of the things that our coalition supports is the abolition of the current laws regarding the distribution of methadone. Methadone is life-saving treatment for many people, and the federal regulations that force people to attend a methadone distribution clinic on a daily or weekly basis is simply onerous. And we would like to see methadone available at your local pharmacy through a prescription written by your physician. So we would like to abolish the methadone distribution model that is currently in place in America.
Yeah. And when we talk about legislative priorities, obviously we see these things out there. What's getting the most traction right now, and what do you need the most support in?
I think a bill that has been proposed by our state assemblywoman Inez Dickens for the safeguards regarding the overdose prevention centers, I think would be a great first start. We're simply looking for equity, and we want to make sure that these programs, which save lives, which really improve people's capacity to engage in this world as family members, as parents, as colleagues, as neighbors. We want those, but we want them equitably distributed. So all New York neighborhoods, all boroughs need to take their fair share.
When somebody asks you the question, what do the residents of Harlem say when we talk about these particular issues? You're right there. What are people saying?
Most people that we work with and we talk to want to have their fair share, but unfortunately, through decades of systemic oversaturation, these programs have been overly concentrated in a few small neighborhoods, and it's simply inequitable. People simply want equity.
Yeah. We've got a big problem in New York City, and that, of course, is that of homelessness. We know Harlem has been hard hit as well. Sometimes I could walk down 125th Street and, you can go to either side of the spectrum. I'm over there by Park Avenue. You'll see that there's an influx right now. It seems as though things continue to be a challenge. From your lens, talk to me about homelessness and what's your take right now?
It's a very complex problem, and as you undoubtedly know, mental health plays a huge role in that, as well as the unaffordability of housing today. As a city, we need to build more housing. We need to build it, and we need to build affordable housing.
We talk about housing, we see a lot of development going up, but the question is that development really affordable, and is it attainable for people who are within that community? And then also at the same time, looking at those who are homeless right there. As you're looking out and looking at the landscape over there, you can't be too happy with all that you're seeing in this regard.
Exactly. We need to find better mechanisms, financial, legal, that permit and encourage mixed income housing. Ultimately, my perfect vision for this would be that wealthier neighbors in the same complex end up subsidizing people with fewer resources and who need a leg up. So mixed income housing with deep affordability, we need to get on this, because at the moment we are in a housing crisis, as you point out.
Yeah, and I also want to get the opportunity to get your take on some harm reduction programs. We talk about that. There's plenty of harm reduction programs that are out there, but from your perspective, your landscape through the lens of Harlem, what do you see?
So one of our concerns is that harm reduction programs have been so intensely focused on the user that they've actually failed to consider the residents nearby. And we are advocating a model of community harm reduction, which encompasses people who need treatment, need services, need referrals, need access to clean drug use paraphernalia, etc., but also considers the needs of the neighbors around, and whether that has to do with needle litter, loitering, increased drug dealing, etc. So we really envision this model of community harm reduction, that community harm reduction takes place both in the facility, but also outside on the street, on the sidewalk, and on the stoops.
Yeah, and as we look towards, this harm reduction, or look at harm reduction, I should say, are you satisfied by what you're seeing? I mean, in terms of, we got a lot of people out there, on the street, but the question is, are things going the way they really should be going? And so take that a little bit further for me.
I think that harm reductionists are trying very hard and have been extremely successful in reducing the amount of the transmission of HIV, as well as hepatitis. They've been fantastic with that. Their work in education is incredibly effective. What they are perhaps less effective at is actual moving people from addiction to medically assisted treatment, or moving people from addiction into some kind of recovery situation. So they've been less able to do that. Also, the numbers of overdosing in New York are horrible. We've surpassed over 3,000 annual overdoses in the city. The South Bronx and Upper Manhattan are particularly hard hit, and we need to do more. And I'm hoping that the harm reductionist in New York City will take a close look at what they're doing and revise and update, because at the moment the fentanyl crisis is simply continuing to grow.
Yeah. We're getting short on time, but I do want to get our people connected to you and the work that you're doing. For people who want to get connected, what's the best way for them to do that?
Just head to greaterharlem.nyc.
Yeah. And for yourself, as we point, I mean, it's kind of hard to say, but it's we're almost at the place where we're talking about the end of 2023. But as we're looking towards 2024, what do you have your eyes set on as far as work in Harlem is concerned?
I think we're looking forward to mobile van distribution of methadone being located on Ward's Island. This is life-saving medicine that is needed by many people who want to get off opioids. So we're very excited about that. And I think that's the main thing we're looking for by the end of December. It should be in place.
And so December is coming like around the corner, and it's hard to believe that we're talking about that already. But a lot of great things happening in Harlem, but then again, a lot of challenges as well. One more thing before I go, Shawn, talk to me about community and Harlem residents, how resilient they've been in the face of all of this, right? Because there's a lot they've had to contend with from the gentrification all the way down, but yet and still, the voices are still being heard.
Most definitely. And, you know, I as a new resident of Harlem stand on the shoulders of so many that have come before me, worked tirelessly to try to improve the neighborhood and better the lives of people here. And at the end of the day, we all want to support people on the path to recovery, on the path to healthfulness, and anything that we can do to support them on that is something that is positive. But unfortunately, overly concentrating programs in a small geographic area does not help patients. It only helps drug dealers.
Mm-hmm. Yeah, a lot to talk about there. And I mean, the truth is, you said it best. And I mean, I think there's some work that needs to be done, and we have to continue to be a voice for the voiceless. Thanks a lot so much for being with us, Shawn Hill. He's a Harlem community activist and also co-founder of the Greater Harlem Coalition. And thanks so much for being with us.
Thank you very much.
All righty. Well, we come to the end of our show today, and I hope that you enjoyed this week's discussion on the Bronx Social Justice Forums. And to rewatch the episode, we ask that you catch the recablecast right here on BronxNet.org. If you want to join in on the conversation, presenting your point of view, you can visit our social media at BronxNet TV. Join us next week. We continue to elevate the discussion and bring further awareness across the globe. I am your host, Daren Jaime, saying thank you, take care, and God bless.